Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
All right, so welcome everybody to this week's episode of the Prospective Doctor podcast. I'm Dr. Sahil Mehta. I'm going to be your host for this week. And we have a super special episode today, really focused around osteopathic medicine. I have two incredible guests with me. I'm going to introduce them both and let them tell a little bit about themselves. But first, it's a great pleasure to introduce Dr. Robert Cain to the podcast. Dr. Cain is a pulmonologist by training. He's the former Dean of Clinical Education at Ohio University College of Osteopathic Medicine. And now he's the president and CEO of the American Association of Colleges of Osteopathic Medicine, better known as the AACOM. And also, I just found out a Olympic powerlifter who continues to powerlift to this day. Dr. Cain, welcome to the podcast.
Thank you. Happy to be here with you today.
Also with us today is Ragav Sharma. Ragav's a fourth-year osteopathic student at Midwestern in Chicago. He's also a med school coach, UMLE and COMLEX tutor, and he even hosts his own podcast, the Preventative Medicine Podcast. Ragav also is a power lifter, so I'm joined by a bunch of very powerful physicians here today. Welcome, Ragav.
Yeah, thanks for having me. I really appreciate you offering the opportunity.
Awesome. So, I wanted to start off the podcast discussing a lot of the news on social media, as well as sort of old school media that we're seeing today about osteopathic physicians and their role in the healthcare system. On one hand, we have both our current presidential candidates, whose primary care providers are osteopathic physicians, right? Dr. Sean Connolly actually got a lot of press recently, of course, with Donald Trump's COVID diagnosis and his hospitalization. And Dr. Kevin O'Connor is an osteopathic physician as well as a primary care provider for Joe Biden. I mean, such incredible, great exposure, and the prominent roles that osteopathic physicians have in sort of our healthcare system are clearly displayed there. And on the other hand, you had a very popular sort of physician clothing company recently put out an ad that was potentially disparaging both to osteopathic as well as female physicians. So I wanted to get sort of the pulse. Dr. Cain, what has the AACOM been seeing and thinking about all this recent exposure?
It's certainly easy to become frustrated by things like the advertisements that we saw from the Scrubs company, right? And to react to that. And it's easy to be pulled into the negative conversation about the president's physician. And I think what we've tried to do from an AACOM perspective is say, let's stay focused on the big picture of what's actually happening today. And let's send the positive messages and keep telling the story about osteopathic medicine and not use time reacting to that. Let's do what we do best. Let's educate people. That's what we are. It's an education association. And let's carry that forward. So we've really tried to continue with our messaging that can apply to both students who are looking, saying, there are 2 degrees out there, right? Which one is best for me? Or are both fine for me? And here's why. But let's help them to see what osteopathic medicine is about. And to the broader community, let's do the same thing.
Ragav, on your end, as a current student in osteopathic medicine, how about yourself and, sort of the pulse of your fellow classmates? Anything different, any buzz on the ground?
Yeah, so I think with students, there's just been most of the buzz is on social media, and we're seeing a lot of things on Twitter, on Instagram, and on Facebook about either news outlets or other people just talking down on osteopathic physicians. But there's been outpouring of love from the entire medical community, which has been absolutely incredible to see. No matter whether they're an MD or a DO student, no matter what, just everyone has been very supportive of DOs, and that's kind of mostly what I've been seeing. In person, it hasn't really changed much at all. I think we haven't really experienced anything against DOs at all during my clinical years yet, and I don't anticipate it being so. Everyone's just super encouraging, so it's good to see that.
For years, I've worked with prospective students and sort of tried to make sure that they understand the full picture, right? That an MD and DO at the end of the day are practicing pretty much the same medicine in the same locations and doing the same things, and are completely 100% equal and capable. But I would say that there are reservations from students sometimes.
At Med School Coach, we know that studying for the MCAT exam can be challenging. especially for busy students on the go. That's why our team created MCAT Prep, the only all-encompassing study app built specifically for the MCAT. MCAT Prep by Med School Coach provides student access to extremely high-quality content and a personalized curriculum for free. The app has more than 250 videos, 1,000 flashcards, and 1,000 unique MCAT questions. Plus, MCAT Prep by Med School Coach allows students to create a personalized study schedule and track progress over time. You need every competitive advantage you can get to get into medical school, and now you can put the experts from Med School Coach into your pocket. It's the closest pre-med students can come to a personal tutor without spending a penny. Download MCAT Prep by Med School Coach for free at medschoolcoach.com/MCAT. Or download it directly from the Apple Store or Google Play Store. You can achieve your medical school dreams, and MCAT Prep by Med School Coach can help.
Dr. Cain, I would love to understand sort of the AACOM's mission in this and, what you see as a very successful physician in your career as the main differences really between osteopathic medicine and allopathic medicine and how that's played out over your 20, 30-year career.
Well, there are a couple of different ways I think we have to look at what are the differences and what are the similarities between the two degrees. And to your point, at the end of the journey, both degrees allow you to practice medicine in an unlimited, unrestricted way in the United States, right? That's the important message. And so if I want to be a physician in the United States, I have two ways that I could go down that path. And I think what becomes important is looking at the subtleties of each degree and making a decision about what is it that best fits my needs and the type of person I am in terms of the way I want to practice. And the other thing that's important is to keep in mind that these aren't absolutes, that MD is this and DO is this, right? There is a lot of overlap in the space between the two degrees. And I actually see them, the way I try to carry on conversations with other organizations and individuals is they're complementing degrees, right? We live in a really complex healthcare system, lots of sectors and segments at work. And the idea that in the US, we have two ways of looking at those problems, that if we will actually work together, we can potentially do more for patients, I think is critical. So my entry point is to think of it this way, and maybe this is simplistic, but if you and I were right now standing on the opposite sides of a house, looking in through windows into the same room, we're going to have a different description of what that room looks like, right? But we're both looking into the same house. And so part of osteopathic medicine, the two biggest things that become differentiators, go to an MD or DO school, we both learn biomedical science, right? We're going to take the same anatomy and physiology. There are different ways to teach that. We're going to do clinical science, right? We're going to go through a series of rotations in surgery and family medicine and so forth throughout our experience. Today, we've added health system science to that. So both of our schools are learning about how our students best learn to interface with the healthcare system. But biomechanical science is a fourth science that's added to the education of the DO student. Okay, so thinking about the part that addresses structure function and our use of manual medicine. The other piece that's important, all of that is delivered through a lens. So throughout your 4 years of medical school, there's this philosophical lens that overlays how you see biomedical science, clinical science, biomechanical science, health system science. So if you're attracted to that, we're going to emphasize certain things in our schools that are intended to be, I'll say, more physician servant oriented. If we think about physician scientist and physician servant, again, both incredibly important, neither mutually or not exclusive, but that lens increases that servant side for a person.
It's so obvious that at the end of the day, we're all working towards exactly the same goal. It's incredible that I've seen that this MD versus DO debate, because it's not versus. That doesn't make any sense, right? I mean, I work alongside osteopathic physicians every single day, and osteopathic physicians work alongside allopathic physicians every single day. We're on the same team, of course, but we're just completely equal when it comes to taking care of the patient. And so it's interesting that students still have a conception of the MD versus DO versus just saying MD and DO, both degrees, which at the end of the day treat a patient.
Well, that's why I like that word complementer, right? I mean, that they are complementing each other.
So Can you talk a little bit about the AACOM and so how the different members schools interact with each other and what the role of the AACOM really is?
Well, AACOM is actually nearing its 125th anniversary, so we're excited about that here in 2023. So we've been representing and working for the osteopathic colleges for a long time, since 1898. So as we look at the role of AACOM, really two of the major things are to serve as a voice for osteopathic medical education, so to represent the colleges, whether it be in terms of advocacy work that's necessary to educate the public, things that we're talking about here today. Part of it is also to identify osteopathic medical education as a pathway for students who are seeking a medical education. Today, we have 38 member colleges on the board of deans. We have 58 locations across the country where students will be training in terms of campuses. That represents about 25% of all medical students earning a medical degree in the United States today. So 25% of students are earning a DO degree. Interestingly, I think the pandemic has improved the way we interact as an organization, not actually harmed it. Instead of our twice a year board meetings and our intermittent executive committee meetings, we've been meeting weekly with our board of deans since the start of the pandemic. We've increased and developed new groups inside of AACOM that have connected parts of our medical education programs that have never been talking to each other before in the same way. So we serve as a conduit to really bring together our stakeholders in ways that allows them to focus on improving education for our students.
You mentioned something there. 25% of graduating physicians in the United States are osteopathic physicians. Has that number gone up in the last number of years? Is that always been the case?
That number has been steadily increasing over the past 3 decades as new DO schools have opened across the country. About 20% of those schools operate in federally designated rural and underserved areas. And so we're really trying to meet some specific needs of underserved areas of the US. But yes, the number increases and will continue to increase with some of the newest schools that are yet to graduate students.
Ragav, I'm interested from a student perspective, as you were going through the application process, applying to medical schools and ended up choosing, Midwestern, one of the fantastic osteopathic schools out there. Like, how did you make that decision, that determination? Were there any reservations that you felt going into an osteopathic school?
Yeah, so when I was in undergrad, I actually hadn't even heard of osteopathic school until I think it was just a couple of months before we started applying. And I think it was my father who actually told me about them. And the reason he found out, he loves to do research, which is good for me, I guess. But he found out about it because I'm very interested in musculoskeletal medicine. And then as he was doing his research, he found that there was an osteopathic pathway, which emphasizes that through the manual medicine. And I ended up thinking about it and I did more research. And then I ended up applying both to MD and DO schools. And I was accepted to several DO schools and a couple MD schools. And at the end of the day, I decided that Midwestern was the best fit for me because number one, for me, it was close to home. So that was a great fit. And then number two, because of my future career aspirations of wanting to do musculoskeletal medicine, I thought that being trained in a manual medicine technique and going through a school in which we have that kind of philosophy in there, where you kind of treat the body as a whole unit and understand that there's various things that can go on at once, and also incorporate the ability to treat a patient manually with whatever else they have going on. I thought that would complement my skill set for what I wanted to do in the future and just give me another tool in my toolbox for when I do become a physician and when I'm able to help patients with that tool.
So I'm interested because, Ragav, you're going into PM&R, right? A very sort of musculoskeletal based specialty. And Dr. Cain, you're a pulmonologist by training, maybe not something that people necessarily equate to musculoskeletal system or, sort of osteopathic medicine and the biomechanical techniques. But there must be some aspects of that you've still taken to practice, Dr. Cain, over the number of years that you've been in practice. Like, where do you really feel like that training comes in? And how do you tell a student who maybe says, you know what, it's one thing to tell a student who's interested in orthopedic medicine, who's interested in PM&R or something that's very biomechanical, but how do you tell that student that, hey, if you're just going to be a internist, or if you're going to be a pediatric specialist, or if you're going to be a surgeon, Where does that biomechanical training really come in and help?
Sure. Well, actually, I think the respiratory system actually lends itself incredibly well to the biomechanical science piece. So if you think about how the chest wall itself is constructed and what it takes to actually take a breath, it's mechanical, it's biomechanical. And so as a pulmonologist, I think that one of my greatest joys was to say to a student, we're having trouble weaning a patient from the ventilator. And so all too often, if we think about an exacerbation of COPD as an example, right, the problem they're really experiencing from the bronchospasm, the increased airway edema, the secretions, is increased work of breathing. So anything else that increases work of breathing on top of those is only worsening their problem. So as a DO, not only would I be giving medications to reduce the edema, to reduce the bronchospasm, to reduce the secretions, I'd be looking to see, are there changes to their chest wall that are in any way causing increased work of breathing, that if we treat that as well, we have the opportunity to improve the chances of getting this person off the ventilator. But the same is even true before the person goes on the ventilator. Is there anything that's actually keeping their work of breathing high that if we could reduce it from a mechanical standpoint, we decrease the likelihood of them going into respiratory failure?
I was just on my acute inpatient rehab rotation, and on there, we don't think of someone who suffers a stroke having respiratory difficulty. However, there was one patient which was not able to breathe as effectively as she should be able to. And then I think together with my osteopathic knowledge and background and everything, I kind of ended up proposing the idea that maybe also her muscles are not necessarily as strong as they should be due to the stroke, because at the end of the day, they are muscles as well, which help you take breaths and to exhale as well. So kind of together with the attending, we also discussed that, and we ended up making changes to her bed positioning and maybe adding a little bit more respiratory therapy in terms of her doing more rib expansion type exercises, and that ended up making a difference in management. And we didn't necessarily do any OMT on that patient, but it's kind of just the philosophy and the background of that knowledge that was able to help make that suggestion, which at the end of the day impacted care.
For students out there, I think what you're hearing is from two osteopathic physicians who are practicing very different specialties, just how important it can be no matter what specialty you're practicing, and how incredibly useful actually the skill can be, regardless of what eventual career path you take. Talking a little bit about those career paths, though, I mean, one of the big things that students I've always questioned or talked about or worried about is the residency component, right? As an osteopathic graduate, am I going to get the residencies I want? Am I going to be able to match into a specialty I want? Dr. Cain, a couple of years ago, this idea of a merger between graduate and medical education came about, and I believe it was just in July that the merger sort of fully consolidated. Can you talk a little bit about that and what that means for students?
We've spent 5 years working to bring together the two graduate medical education systems that existed side by side in the US. And so for many years, the American Osteopathic Association accredited graduate medical education programs. The ACGME has been the other major accreditor of graduate medical education. A decision was made that we would create one system for graduate medical education. Now, importantly, in creating that, the osteopathic piece was not lost. And so the ACGME went to great lengths to create a committee inside of ACGME called the Osteopathic Principles Committee. It oversees a program called Osteopathic Recognition, which actually created the footprint for osteopathic medicine inside of ACGME. And over the years, we've had the opportunity to seat physicians on each of the review committees so that there's an influence from the osteopathic community in terms of the requirements and the way those requirements are administered. For our students, that meant over time that eventually the AOA match went away. This past year, we had the first single match where all students moved through the NRMP system. The outcome of the blending of those two systems, at least from a match perspective, was successful this year. 99.29% of our students matched and ultimately placed into residencies, which holds just about the same place we have been for the past 5 years. And so we've been at relatively the same numbers. Are there concerns? Absolutely. And I think that anytime you create a change of that magnitude, there's always that, what will happen to me? What will it mean for us? A lot of work has been done behind the scenes by our schools and the people on each campus, by AACOM itself and councils and committees that we have trying to support this, to make sure our students are prepared, to make sure the match is strong, and that hopefully as we move forward, we'll continue to see that kind of match result. In general, the thing I always try to say to our students and certainly prospective students people desire the product coming out of the DO schools. And we hear very, very positive feedback from program directors and institutions that for a long time have been accepting DO students. And certainly the stories about them becoming leaders and practitioners in those institutions.
Ragav, on the end of somebody who's currently sort of going through the application process, I mean, how do you feel? Any words of wisdom for students who may be coming after you?
Yeah, so the process is definitely very daunting, and we're in a new system where it's kind of matched, everyone's together. We don't necessarily know how this is going to play out in 5 or 10 years, but so far it's been going very well, as Dr. Cain just talked about. And I combed through the data myself, and it looked fantastic to me, and it looks like we're just continuing on what we have been. So as far as that goes, that is one variable that I don't necessarily worry about as much because it's just something that I can't control. So coming from the student perspective, I think the biggest things that we can do as students is control the variables that we can. And that is your board scores, how you perform in medical school, your grades in medical school, your clinical rotations, and how much you learn. So coming it from that perspective, I think that as long as you try to maximize that and try to do the best that you can for whatever field you want to go into, then you'll be setting yourself up to succeed. And for me personally, I'm applying to PM&R, which is a field that I've been wanting to go into for quite some time. So I've been able to kind of tailor my everything that I do towards that. And PM&R is also a field that's historically very accepting of DOs as well, which is kind of lowers the stress just a little bit because there are other fields which historically might favor MDs more than DOs that are more prestigious, quote unquote. So as far as that's concerned, I'm not super worried.
Students definitely have questions about, which is board scores and the boards that you have to take as an osteopathic physician, COMLEX versus USMLE versus both. Dr. Cain, what does the AACOM sort of talk about and think about or advise a student to do who is going through the process right now of maybe their first year osteopathic student?
Well, one of the challenges in this, I think we have to recognize up front, is that unfortunately the licensing exam is used for a purpose it wasn't intended, right? We have to be really clear about that. If it wasn't being misused, some of the questions we sometimes see arise around USMLE and COMLEX actually wouldn't be there, right? And so our COMLEX licensure series is intended to reflect those 4 sciences and that lens that I talked about in the beginning. And so we're really trying to assure that people who are going to practice through that lens are prepared to do that and to do that safely for the public. I'm very confident the test does that. We continue to work to increase the awareness of all program directors and to create equity between those 2 exams in all GME programs so that no questions exist for our students. But our position remains that COMLEX is a sound approach to licensure, that our students are matching into the programs that they want to match into, and that there are cases where students will select to use the USMLE because programs have set the expectation that's what they want to see. And really the unfortunate message there is that they're being asked to do 2 examinations. So it's something we're working on to change that so that the students have a single pathway to licensure. But the success from our standpoint is students are matching. We have to think about things on an individual basis, whether those extra exams take place, but we're going to be continuing to try to change those conditions.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to a medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. That's why more students than ever are turning to MCAT tutoring by Med School Coach. Our tutors are all 99th percentile scorers, have been through rigorous training, and can help raise your MCAT score by 12 points or more. You need every competitive advantage you can get to get into med school, so why not get one-on-one tutoring from Med School Coach? Our expert team will create a custom program just for you and help you master MCAT content where you need the help most. You'll raise your MCAT score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach MCAT tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
Ragav, as a med school coach tutor, you tutor students through the USMLE and as well as the COMLEX. I mean, what are the real differences that you see? Can a student study for both of them simultaneously in a way that makes sense for them? For those students who are applying to specialties that maybe say USMLE is important, or they've heard that the USMLE is important for them as an osteopathic student?
Yeah, so for the most part, I believe that the content reflected on both exams is very similar, but they have a different approach of asking the questions. So as far as studying for the exam goes, then you can essentially use the same resources, and you don't necessarily need to study separately for a USMLE exam, then take time and study for a COMLEX exam. You can hit two birds with one stone there. And at the end of the day, when it does come to COMLEX, you have to have the addition of osteopathic medicine and kind of use that lens of osteopathic medicine to approach some of the other questions. And that is where the only real difference and only thing you would need to add is a question bank, which kind of imitates the COMLEX style questions because they are the same material. It reflects the same material, but it asks it in a slightly different way with the addition of OMM. So that's kind of the real only addition that I suggest as a tutor to students who end up taking both exams.
So, Dr. Cain, let's say in 10 years, do you see any big differences on the spectrum of where osteopathic medicine is moving towards? I mean, do you feel like people will be, quote unquote, more accepting for the profession, that students will have less questions when they're applying? What's the overall end goal of AACOM and sort of the osteopathic profession in 10 years?
Well, if I think about it also within the context of your last question, the opportunities I've had in the last decade, whether it be as the first chair of that Osteopathic Principals Committee that I was talking about, whether it be in this particular role, is to sit in rooms with individuals across the House of Medicine that it's very clear more people are talking about osteopathic medicine than ever before. And oftentimes we're not having to start the conversation, right? The question is, they want to bring us to the table and engage us in a conversation, whether it's about building the workforce or addressing healthcare issues. So I think that the opportunity for us to solidify our space in that big healthcare system that we've talked about is sitting in front of us. It's our opportunity to make something of that over the next decade and to then be clear that this is what we can contribute to change. So as students come in, I would think they will continue to see increasing interest in the approach to healthcare that I hope we deliver based upon our philosophy and our message. Continue to see increased numbers, increased acceptance of the things like you were just asking about through ongoing education and awareness, and that they can, at the end of that journey, is just like I am today, be proud of the degree and proud of the experience, proud of the opportunities that they'll have in medical practice.
One of the things that we see from students is that they don't get the exposure to osteopathic medicine that they do to allopathic medicine. And more specifically, maybe they don't get the chance to shadow DO physicians like they do get MD physicians. I mean, maybe this is simply a 75-25% split. As we mentioned, there's just more MDs around. But students are oftentimes lacking the experience or don't have the opportunity for the experience. Can you talk to how students may be able to get some of the experience in shadowing osteopathic physicians and seeing what they do on a day-to-day basis?
Question about my own entry into osteopathic medicine. If it hadn't been for shadowing experiences, I would perhaps not be sitting in this seat. And so I recognize how important those are. And people saying, let me tell you about osteopathic medicine. One of the challenges I think we face today is how much regulations have gotten in the way of being able to get the shadowing experiences that people actually need, right? So 40 years ago, when somebody could look at me and say, hey, come to my office and watch what I do, it's just not that easy today, right? And so the excitement for me is watching that within AACOM, we have a group called Pathways. And so Pathways is let's call it multi-professional approach. People from different parts of the healthcare medical education programs coming together to look at the admissions process into our schools. And so asking questions like that to say, what is it that we can do to help overcome that problem? Could it be done this way? Could we develop virtual ways of connecting with osteopathic physicians and developing relationships? What are things that can replace perhaps that live, I have to get that letter and meet with that individual to move forward? So I think it's really a process in evolution. And actually, the pandemic has given us yet another reason to have that conversation. Your other question there, yes, it's 25% of medical students, but we're still only 11% of physicians. So you do have to sort through and find those individuals. And if you're in a community where you can't, we need to have alternatives.
Yeah, I mean, it's something that I sense with a lot of the students that we work with and that come through and ask questions. When we expose them to osteopathic medicine, they may get excited. Their initial reaction is either, oh, I heard about it, I'm excited about it, or I've not heard about it, but how can I find out more? We definitely see that last hurdle as one that is substantial from a lot of our students' perspective. Because once they do get the chance to talk to, speak with, see what an osteopathic physician has done, talk to somebody like yourself, talk to somebody like Ragav and see, wow, we've gone through the process. This is exactly what I want to do. They almost always come back and say, yep, osteopathic medicine actually seems like it might be a good fit for me. I want to apply to some schools, or this is a route that I'm going to think about taking. But it's that initial hurdle that sometimes is pretty difficult. And hopefully you mentioned, in a slightly positive way of this COVID pandemic, this will allow some of those barriers to be broken down, and maybe we can do it in an easier fashion for these students.
Of course, check each school, the uniformity and where it stands in terms of the expectation related to that. And again, I think those ongoing conversations, hopefully we see evolution so we get creative on creating those connections.
Ragav, any final thoughts on sort of as a student who's recently going through the process or going to be graduating very soon, for prospective students who are thinking about the osteopathic field?
Yeah, I just wanted to touch on the other question as well, talking about students being able to shadow and getting exposure to osteopathic medicine. I just want to add that I as well kind of solidified my choice to go to a DO school after shadowing a physician as well. He was just fantastic, so I decided to continue on with that. And I also want to add to that I think when we're growing up, a lot of things that we see on media, whether it's on TV or social media or anything, anywhere you look there always seems to be an ID badge with an MD on it. So that's where a lot of students start with their first impression of this is what a doctor is. Whatever show you're looking at there, it's like House MD, whatever show it is, they always have an MD badge. And even on social media, now that osteopathic physicians are only 12% of total physicians, as you were saying, Dr. Cain, of those 12%, how many are popular in social media and how many of them are posting things on social media talking about being an osteopathic physician? So I think just of the larger majority of MD physicians out there, there's going to be a larger number of them on social media talking about it. So that's what a lot of the newer generations being exposed to. So in terms of social media, there are definitely a lot of osteopathic physicians that are talking a lot more about it. I think Dr. Mike is probably the biggest one out there right now. But there's several others. So I think that as that trend continues, there are going to be more students that learn about osteopathic medicine and might start applying to DO schools.
Yeah, I mean, as you think about it, there's no better time than now with all the tools that we have in social media to be able to disseminate the right information to people directly from the source, filtering out any media, filtering out any other intermediaries. Osteopathic physicians can go straight to the student and talk to them via social media and other platforms. So Ragav, Dr. Cain, I mean, I think this has been a fantastic discussion. I think our students hopefully have really been able to understand and wrap their head around the osteopathic profession and the choice of MD and DO schools a little bit better. And it doesn't have to be a choice that they make today, tomorrow, or even in a year from now. I think exploring and understanding and getting exposure is really the most important at the end of the day. Complementary, as Dr. Cain said, right? I mean, we all at the end of the day are looking at the same house and trying to take care of that same patient, maybe just through a different lens. But at the end of the day, we're all treating that same patient. And now more than ever, as we found out recently, physicians are needed, and physicians are needed who are physician scientists, who are physician researchers, who are patient-centric physicians. You need every single specialty from primary care medicine all the way up to a super specialized plastic surgeon, and osteopathic physicians have a role in every single one of them, as we've learned today. Dr. Cain, thank you so much for your time. Appreciate you being on here.
No, thank you very much. I'm happy to have had the chance to spend some time with you.
Ragav, thank you as well.
Yeah, thank you, Sahil, for the time and opportunity once again.
If any of you guys are interested in learning more, go to perspectivedoctor.com. We have a lot of articles there. We'll have a link to this podcast as well as a transcript so you can kind of go back and take a look at some of the things that were said here and be able to also find out and research the osteopathic profession a little bit more. We'll have links to AACOM as well, so you guys can take a look around, see the different schools that are out there. Thank you again, Ragav, Dr. Cain. This has been fantastic.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time